The province is moving to further restrict the safe supply program.
We are helping to separate people from the illicit drug supply through prescribed alternatives program. At the same time, we know it's so important to make sure that these medications only land in the hands of those people for whom they are intended.
As of December 30th, all patients who rely on prescription opioids, such as hydromorphone or fentanyl patches, will have to take those drugs under the supervision of a pharmacist or health professional. Key exceptions include some in rural communities and people who can show that their work schedule does not allow them to go to a pharmacy several times a day. The move to witnessed safe supply was announced in February and initially only applied to new patients. It came in response to evidence that prescription opioids were not being consumed by the intended patients, but instead being diverted and trafficked. But one Victoria-based addictions doctor says the changes make it harder to access safer alternatives and risk pushing people back to potentially deadly street drugs.
This is really egregious political interference in medical decision-making. It doesn't really support recovery. It doesn't really support people getting on with their lives, being basically chained to a pharmacy all day long.
BC Conservative addictions critic, who herself battled addiction for years until going to treatment at 19, says the government's safe supply program keeps people in the cycle of addiction.
If the government was going to pay for my drugs and provide them to me for free, I probably wouldn't be standing before you right now.
The program was rolled out in March 2020 during the height of the pandemic. The government changed course earlier this year after leaked Ministry of Health slides showed that a significant portion of the opioids and fentanyl patches handed out by doctors and pharmacists are not going to those who need them, and instead being trafficked nationally and internationally. Osborne says the health ministry continues to investigate the dozens of bad actor pharmacies. Those pharmacies were alleged to be offering incentives to entice clients to get their safe supply drugs from them. Katie DeRosa, CBC News, Victoria.